city. I don't think they've had an opportunity to present to council, and they have been very impactful on the work that they've been doing. So with that, Chief, I'm gonna let you introduce your team and take title one.
So what Autumn coming up, Captain Autumn Melton is in charge of our coaching. She's our program coordinator for the team. But Autumn, if each member of her team will stand up and kind of scatter around. She's going to present the council in a few minutes. What our team's doing today. Okay.
Welcome, Autumn.
Thank you so much. Should I stand? Should I sit?
Whatever you're comfortable with.
Sit.
That's fine.
I'm a little nervous.
No,
so-
don't be nervous. Don't be nervous. We're glad to see you.
We're very happy to be here. I'm very proud of my team. They've done exceptional work. So we're very grateful that our name has been getting out there. We've been receiving a lot of accolades from community partners in the city and the county as well. So we're very excited. And thank you for having us. And I apologize if I go too fast. I'm very nervous. So I believe we had a presentation. All right, so a lot of people are kind of confused who we are. We are settlement funded. So back in 2022, there was a national settlement across the nation, and everybody who participated was able to get some money. And so there was $26 billion that was awarded through this litigation. And South Carolina is going to get more than 360 million of that, and the city of Greenville got 2.27%. So that is allotted out over time. There is not currently a set rhyme or reason that we have been able to find as far as those disbursements. These funds must be used for opioid abatement strategies. So it's not something that we can just use for anything. Hence why our positions are funded through this money. And we are not therefore running fire department calls or 911 medical emergency calls or things like that. Great. And so our team and function, so there are two of us. As you can see up here, we've kind of divided them. Me and Marley, he was our data analyst back there in the back. We started at the end of our first year. And so my job was kind of to build the program and the community partnerships. And then I assist with patient care and education outreach. Marley oversees all of our data, and she oversees the records management system that we use to collect all that information. So in our next slide, we have our response specialist, Brian Creswell, who started at the beginning of year 2. And I'm going to go ahead and just let y'all know he is the backbone of this program so far. He is the one that is out in the streets. He has done a lot of this work. He has kept up our community partnerships and nurtured those partnerships and made them what they are today. And that helps us connect these patients where they need to go. Kirby Reinhardt was just added recently, very, very recently. She is now going to be our education and outreach specialist because of our overwhelming interest in this situation and in the epidemic. And we'll see later the impact that it has made and why her position is very much needed. So one of the most important aspects of what we do as a team is stigma reduction. And we have to explain to people that this opioid use disorder is a chronic, but it is a treatable disease. And it affects people from all walks of life. And so that's kind of what this slide is showing, is that everyone wants to think, not my family, not my community, not my town. This is affecting our state and our county. Unfortunately, no one really has census data track as far as the city is concerned. So that's why you're going to see a lot of this as county referenced. 2017, in 2017, a study was done, and it was based off of South Carolina and this epidemic. And since then, the CDC and other agencies have been using that information to compile inflation and things like that to kind of show this economic impact and how it's affecting our state. So as you can see there, like I said, everybody wants to say, not my town, not my family. And since 2015, the county of Greenville has been in one of the top 3 of all 46 counties that we have of overdose deaths. These are just deaths. I'm not even putting up here the associated numbers that they assume for the opioid use disorder. Okay. So this is an impact. If you would like to know, we do a whole presentation on this, but across the United States, the original back in 2023 was that there were over 110,000 deaths. And to put that in perspective to everybody, that's the equivalent of a Boeing airplane going down every single day. That's the number of lives that we're losing across the nation. So it's not, again, it's not just our community, it's across the nation. And as you, like I said, these are the deaths. This is the impact that it's having. If you would like to go to the next one. But I would also like to say our city is amazing, and we have done great things, and we have come a very long way. We have made some amazing strides. We have made some amazing community partners out in the county as well. We have made a massive impact, as you can see here. So 2023 was the first time that we've seen a decrease, and that's 72 fewer people. So that number might not seem like a lot to some people, but that 72 was the highest in the state. So we might be in the top.
Bravo.
Thank you.
Job, Mom.
And that's not just my team. Again, this is the county, but I do want to promote my team because they do amazing work day in and day out. They're with these patients every day. And we're also using numbers from 2023 because these are preliminary numbers for 2024 and 2025. So that's why we kind of, along with the nation, we've kind of said, okay, 2023 is set. So 2024, we are actually preliminary numbers showing that we're seeing another decrease. So when I looked at the numbers that I have available to me, it looks like it's so far trending at an 8.8% decrease again. So, and that again is preliminary, so we're hoping to see that increase. Yes, thank you. And so again, this is just the things that my team have done. And while we are going into year 3 and we are getting allotted this new disbursement from the SCORF, which is our South Carolina opioid recovery fund, sorry. That's SCORF, they are our governing board. They're the ones who determine if we're allowed to have, if we're using the money in the appropriate means and things like that. So we apply every single year and they will either approve or deny. We have been approved every single year that we've applied. And so we've obviously just got approved again for year 3. So these funds will be being dispersed, but while we were going into year 3, our team wasn't really up and running until about year 2. So by the time we got hired at the end of year 1 and then made these community partnerships and figured out, you know, where the needs were met. And then we have, you know, Brian who came on board and again, has done such tremendous work. That's where these numbers come from. And so you can see here our 256 outreach. That's where we went into alternative middle schools and high schools where we've seen a massive impact from children that are unfortunately suffering from opioid and substance use disorders as well. I want to say at the time over 40% of their population was there because of some type of drug use. So we got into the alternative middle and high schools. We've trained companies like Bosch and Lomb. We went like 3 days over a period to train not only their first responders, but also their management team and things like that. We provide them with Narcan, which I'll get to in a second. We worked with Prisma to educate their, and their doctors to educate their athletic trainers across the state as well. Now all of their athletic trainers are carrying this Narcan as well. Those 256 events have reached roughly 1,400 individuals. We've helped reduce that stigma. We help teach people how to recognize an overdose and how to treat that overdose. So we're able to do this. Because we are one of only, let me start over. We're able to do this because we were the first and one of only 3 first responder agencies in the upstate to obtain a community distributor designation. And what that means, Kirby there has a little kit that we made. It's called our Leave Behind Kit. We got this designation, which means we're able to hand out Narcan to anybody who may need it. So whether you're somebody who uses or whether you're somebody in the community who just wants to be a good neighbor, that's one of the community partnerships that we've built with other agencies. Be a good neighbor. We teach everybody how to do CPR. This epidemic is affecting so many people from every walk of life. Just carry the Narcan. It's not that hard to use. So we train people. What does an overdose look like? How to treat it with this Narcan. And these are the kits that we leave behind. We leave them, like I said, whether it's a patient or just anybody in the community wants one. So it has 2 doses of Narcan. It has information on where to go to get help. And it has information like our outreach cards and magnets that we've made. People can scan the QR codes and also see all the wonderful resources here in Greenville as well. With that community distributor, we are only one of 17 first responder agencies also in the state that have that designation. So we're very proud of that. And we use that a lot. We have placed 38 individuals in withdrawal management, rehabilitation, or some type of sober living. So that's 38 individuals who are off the street, they're receiving treatment, and they're getting their lives back together. So we have seen people. We are currently working with a young lady. She was honestly one of our first. And so this is kind of like a full circle moment for me. She was truly one of our first. We thought she was kind of a lost cause. We tried. She was 17 years old. She was on the streets. She's now has a job. She's working at Panera and we're working with her to get her GED. So we're super excited about that.
Mm-hmm.
These people, like I said, it is a disease and a lot of what we do is stigma reduction. So these people just need a chance and they need somebody to hold their hand and walk them through where these resources are and then how to navigate it because it gets really confusing. So that's what my team does. That's a lot of what Brian does. That's what Kirby's going to be doing. She's come on board. She's come with us from DHEC. So she's got a wealth of knowledge as well. She created a lot of programs for them. We're very excited to get her up and running. Let's see. Along with those 38 individuals, we have placed them everywhere. Anywhere we can find a treatment, because that is a huge barrier, as we all know. Any type of housing, any type of mental health, any type of anything. So we don't say only in Greenville, we say where's got an opening. So whether it's been as close as Pelzer or Seneca, we've sent people as far as North Carolina, Georgia, Florida, Pennsylvania, Ohio, Virginia, Tennessee, Texas, and Oregon. So we will call anybody that we can call. We will find any bed that we can find, and we will help get these people placed. We try to follow up with these people and maintain at least a 12-month, if they'll allow us to follow up with them and continue to help them through this path. Our firefighters, that's what the referrals from the field. Our firefighters, they have been so amazing. They serve, they protect the city so diligently. They have now started to be able to recognize what we're kind of looking for, where we can help, and they've made all of these referrals. Through those 367 referrals, we were able to do 284 follow-ups and connect individuals to resources over 159 times. So that's resources like transportation, food, clothing, employment, family services, things like that. We do a lot. The general basis of our program is if you come to us and you need help, we're going to help you. If we don't know how, we're going to figure it out. And that's literally, it's honestly just a ragtag group of people. We're going to find a way, we're going to get you there. And then, as you know, a lot of people who suffer from opioid use disorder are unhoused. And so we work very closely with the Homeless Coalition. We have standing outreach days on Tuesdays, Wednesdays, and Thursdays. Brian is primarily, again, the person who is almost always there. He's out every Thursday is when we do primary homeless encampment visits. And in that first year, we noticed that we needed, there were tons of animals out there. And so we reached out, and the Greenville Humane Society has been absolutely amazing. They come out with us every fourth Thursday, and they help to support us anything from food and toys. And then they spay and neuter and give vaccines and things like that.
Wow.
Yes, they have been absolutely amazing. And they're not the only community partner. We could not do this without the amazing relationships that we've made. Phoenix Center, Catholic Charities, the Greenville Humane Society, like I said, the Homeless Coalition, which is a group of people, United Ministries and United Housing Connections and things like that, that we work with. So like I said, this is honestly the work of my team. I'm very proud of them, what they do day in and day out. We appreciate the support of the city. We appreciate you allowing us to come here today and support us. And we are here for anybody who needs help, whether it's you, a family member, a neighbor, you name it. So it affects everybody. If there's any questions?
Thank you, Autumn. Great job.
Thanks, Autumn.
It's very impactful. Hold on a sec, though. Not yet, not yet. All right, we have about 3 minutes for questions. Councilmember Dworkin.
I just want to say, if you were nervous, it sure didn't come across that way at all. Yeah, no, great work. Thank you.
Yeah, I got a budget related question to
Okay.
it. So the 360 million that went to South Carolina, are we still drawing from that every year, or did they give us money directly and we're drawing from that?
Yes and no. So it is, the city got 2.27%.
So roughly 10
And
million.
it's, it is the last I looked, we have, we had a little over $2 million. We received a $63,000 disbursement. This was in April.
Uh-huh.
And so our current is 2.1 million.
That we have in the bank for this program.
We have to apply for that every year. So
Okay.
the last that we applied for was roughly 630,000. And I
Okay.
think because we carried forward, because it took so long to onboard some people, we carried forward roughly 300 of that. So we only applied for, correct me if I'm wrong, about a little over 300,000 this year. So that's what the city currently has to run this program.
All right, so let me ask a more direct question and guesstimate if you have to. When do those funds run out and we as a city need to figure out how we keep you guys running?
That's the hard part. Like I said, I have been trying to track this. I have made a little spreadsheet of when disbursements have come in, and there has not been a set, like I said, this last one was 63,000.
Yeah,
So, they have not told us how this is going to be dispersed. They have not, shown any pattern as of yet. Some of them were one lump sum. They were, like, I think it was McKinsey or a type of, distributor or manufacturer just did a one, what do you call it, bankruptcy.
Yeah.
So for their bankruptcy, they distributed out, and that was it, and that was all we got that year.
okay,
So unfortunately, I can't answer that. It's it comes and goes.
okay.
We are, sorry. No, so we are planning on that with city manager's office on our budget 5-year plans. How we roll this team in gradually over time.
Okay,
One person in, and that funds last a little longer, so we'll bring the second person on So hopefully that funds will last longer and we're able to carry the, whatever we don't spend each year, we will roll back over to the next year. So we can work
Okay.
that process.
Good deal. Yeah, because I think you guys are doing great work. I'd like to keep
Thank
this
you.
going.
So overall, with the sport, my understanding is the city has roughly a little over $2 million to draw from.
Okay,
So it is an annual application, but overall, that was the part that was, portioned, I guess, for
Correct.
lack of a better term, to the city, and we just do an annual, application on that.
okay, good deal.
Great. Councilmember Dow and then Councilmember Stahl, and then we'll have to cut questions.
Can you go back to the very first slide where the budgeting is shown? All right, so South Carolina gets 360 million. The city of Greenville was allocated 2.2% of that,
Yes, ma'am.
so 2.2% of 360,
Mhm.
which is 8 million.
Yes, ma'am.
So,
We just have not, so it's
well,
based
so,
on.
so wait a minute,
Oh,
but not-
sorry.
I get we have to apply for it and all that, but 8 million should be what is available to us to apply for over time.
It's based on
That's
this.
correct. So we have 2 million in our current account that has been currently dispersed. to
Okay.
us. We get.
And so we're about a fourth through it,
Right.
give or take,
Okay.
give or take. Hold on.
Yeah, no.
Okay, so we're approving, I mean, we vote on this once or twice a year, for sure.
Because
And-
it's a 3-year plan that we have to submit, so I think that.
We spent a year, every year we have to reapply.
Okay,
So we take what our carryover is, plus what we're gonna need for the budget for that year. This year was a little over 3.
so is it coming to us once a year? I apologize for not knowing this, once a year to approve, okay. All right, thank you. Next question, you mentioned going into alternative schools, where you would have kids that might have been, they might have been suspended, they might have been expelled, so they're in an alternative school. Are you only going in, because this starts getting into a gray area of where is that school? Is it in the city? Where did that student live? Where, how do you just, which ones are you going to, I guess is what I'm asking.
They were the first ones. We just happened to make a great connection, of a woman who worked in there under another grant. So she was able to get us in based on their need and what we were providing. So, hence Kirby is here now. She's been working real closely. We've been contacting different principals. She's contacted different district, members to see if we can get into other schools.
Yeah, at the middle school level. But my question is kind of vague, because do they stay just in the city or in the school district as a
I
whole?
think that while we focus on the city,
Mhm.
obviously, if there's help that's required outside of the city, we're not gonna say no to that.
Right, right. I mean, I just see a gray area there. And since well, next question would be, is the county getting an allocation of the 360?
They have their own, I believe their percentage was, roughly 7% or more.
Okay. So each individual fire district for the county would be drawing down from that, no, Brian?
If they apply. to
They have to
the
apply
county.
for it. Okay,
Everybody,
EMS right now, EMS is kind of
So
provided.
the county's a big pot. So the sheriff's office applies to the county's pot. EMS
Okay.
applies to the county's pot. Any of those fire departments would have to apply out of that one county pot.
okay. And what do we know about our other municipalities in the county? Anything?
So this team has been a resource for across the state for other municipalities and agencies that are looking to start programs.
Okay.
But I don't know if anybody else has got anything kicked off yet.
Okay, great.
correct. I field phone calls a lot from other municipalities, even across the nation. People have called me as far as Minnesota, to work with their city council to build a program.
Well, we're leading on this, obviously, nothing new there. But our other municipalities have the same challenges, and certainly the county has the same challenges. And I hope they get a certain percent, I'm sure it's based on census, I would assume. So I hope they're proactive in applying for that and following y'all's lead on it. It's a great program. We've been to a lot of funerals on this, so it's a big problem.
Thank you. Okay, Councilmember Stahl.
I'll be
last
quick.
question.
I'll be quick. You said that you placed 38 in treatment, I think.
Yes, sir.
Is there a lack of inventory of treatment options?
Absolutely.
And what can we do to increase that?
It's a nationwide problem, as you know, just like the homeless crisis and transportation and things like that. The way, the answer that we found was, we're not just gonna stay here in Greenville. We're gonna get them wherever there's a bed.
Okay.
Unfortunately, I don't have a
So
better.
if you need to send them to Atlanta, you can send them to Atlanta.
Yes, sir. We work with agencies, Sober Living America, Hope Center Recovery, Waypoint. There's lots of different organizations and we continue to research to find anybody. And a lot of what we do is actually transport them ourselves. That's one of the biggest barriers we have found is, cool, I offer this resource and over here I offer this resource, but nobody's helping anybody to move. So nobody's taking advantage of those resources. So now we say, get in the car, let's go. And if we can't drive you, if it's all the way down in like, where is Waypoint? I always get Clinton and something else confused. Camp, around that camp area, like that's a little bit too far for us to take a city vehicle. So we're gonna use our scholarship allotment and put them on a Greyhound. And we work with the organizations down there to ensure that the person gets there and is picked up and is
Okay.
transported appropriately.
But it's a problem.
Big problem. Yes, sir.
Okay, thank you.
Thank you, Autumn. Great job. Thank you.
Thank you.
Yay, Autumn.
And of course, I want to make sure y'all know that Chief Horton, Chief Hyman, and Chief Crosby here today. So thank you.
Thanks all for coming.
Okay, moving on to our next item.
Mallory.
We are going to now talk about, we're going to move from opioids to talking about parking. So Bill Foster will come up to the table, please.
She gets an applause.
Yeah.
Don't expect it, Bill.
I'm not
Don't.
As we enter a new year, one of the things we wanted to talk to y'all about is looking at redoing some of our parking rates within the city. So with that, I'm going to turn it over to Bill.
Thank you very much. As you all know, Greenville is going through a lot of growth. We have a lot of opportunities that are coming to the city. Development opportunities, growth opportunities. As a matter of fact, I've been in a couple meetings just this last week. So we wanted to look at how parking can support some of that development and some of that growth that's coming up. So what we wanted to do is take a look at our survey. We wanted to take a couple of our South Carolina affiliates, a couple North Carolina affiliates, and then a couple of like operations, just to compare the rates. So for everyone's information in Greenville, we have 10 parking garages. We have 5 lots also. This is mainly focused on the garages. Our first hour is free, the second hour is $2, and then $1 per hour for every hour over that. Our daily maximum is $7. Our monthly is $72. We do have other monthly charges, but 72 is our set rate that is probably 95% of our monthlies. So that's why we really list this one instead of contractual obligations. Our event parking is $5, and we have free on-street parking, which, as you can tell, is one of the things that is unique about Greenville, which is very helpful. As you can tell, as you look down the list, others are significantly higher and significantly, they actually have underutilized garages as opposed to heavier utilized garages. They're able to break it down. Greenville doesn't have that option. Every single one of our garages is utilized to the max.
Bill, not to harp on the point, but did any of these that you looked at that are our sister cities have free on-street parking besides us?
No.
Okay, next slide, please.
Okay.
I think you knew the answer to that.
So then we wanted to look
But
at.
Bill,
when
can you-
we're rating.
On that last slide, you just said we're fully utilized, meaning our monthlies are fully absorbed.
Correct, and I have a slide after this one
Okay.
that'll show that.
Sorry.
That's okay, no problem at all. So then we wanted to look at, well, in the past, what have our rate increases looked like? So in July of 2015, I'm sorry, I couldn't find out what it was before that, but we went to first hour free, $1.50, $2.50, all the way down to a daily maximum of $7. In 2019, council appropriated the money to get our new parking equipment, which pretty much eliminated change. So we changed our rates to have the first hour free, second hour $2. So in essence, we're $1 an hour. And then instead of going to $8, they went to $7. So we went up on the first one and down on the second one. Then when you look at the history of our monthly parking rates, we did a huge increase here of 30 cents in August of 2014. We jumped it even higher when we went the next year from $70 to $72. So for the last 10 years, it's been at $72. So this is a lot of information, Councilman, but this speaks to what you were talking about. I'm a data guy. That's what that's what this parking equipment allowed me to be able to do, is track when our monthlies are coming, when our transient people are coming, who's where, when. So this is the capacity of every one of our lots in our garages. Right here. This was, when we got the new equipment, this is where we were with the number of monthly permits that we had sold, which was a total of 6153. As of August 1st, we are now at 7218. And we have 6,165 parking spaces. Doesn't make much sense, right? We're able to oversell, but the reason why we're able to oversell is because of that data. We then look at our highest monthly usage every month. So to put this into perspective, if you were to look at Church Street, who has 729 monthly, the highest number of people, 53% of those people showed up on the highest day. So every other day, there were fewer than 63% of the people. Same with a loft garage, one garage, you can see as you go down, our average occupancy is about 58% of our monthlies. So that's how we're able to oversell. We know this, we track it on a daily basis as to when our monthly people are coming in. And even though we've oversold it, we still have a large percentage of our garages that are available for the transient parking. They're available for people to come in and have lunch, come downtown, nights, days, and weekends to have lunch.
I want to inject just a little bit right here, if I may. Bill was relatively new in this position during that time, the last time we did all this, and to his credit, he came in and saw our system, and he made the pitch to council to spend a lot of money. It was a big decision, and you told us that if we'll do this, we'll actually come out with more parking availability because we have better data, real-time data on usage and such. So I'm always impressed because you deserve a lot of credit. There was skepticism on this council, to say the least. It was a big commitment, a financial commitment, but we got exactly what you said would happen.
Well, I appreciate that, Mayor, because it was
Also
going
nice to
out
know.
there to say, we now have 1,065 more monthlies by just doing the equipment.
It's so nice to know you're not standing at the garage asking people to move and offering them $100.
I've been there, I've done that.
Have you
I've
talked
also
to the
been
airlines?
Many places where I have shut garages down every single day because we did not have enough space and we did not manage it. And that was my sell to council, is this will give us the information to be able to do that. So I know it's a lot of data, but I wanted to walk you through that side especially. So we would like to make 3 recommendations really on our monthlies, on our event parking, and on our transient, which is the daily parking. Parking rates right now, as we said, we're at basically $1 an hour free, we go on down to a $7 maximum. We're basically suggesting that we go to a $2 an hour. So the first hour would still be free. You're then at 4, 6, 8 with a $10 maximum. So that's where we would propose with that. When you look at our monthly rates, again, these are like the night owl rates, which we offer for our working folks who are nights and weekends, can park at 50% off the regular rates. That would go up slightly. Reserved is a leftover from when we used to do reserve parking. We don't. We were let attrition take care of bringing our reserved spaces back into the mix. But this is the main recommendation, is the $72 for a monthly to $80 a month. And then we do have a couple of lots where we're at 60 and we go to 65. And then the event proposal would simply to go from $5 to $10 per event. Next one, please. So if we took that option and we put it into our survey, this is what it would look like as compared to our other cities. So first hour free, second hour 4. As you go down and you look, even at the daily maximums, we're still less. Monthlies, Columbia has a 65 and an 85, where we would be 80 across the board. So we're still cheaper there. Event parking is either in line or cheaper, except for Durham. And then on street, again, we don't have it, but that's what we compare. So even with that adjustment, we would still be a loss leader in the industry. Can you go to the next one, please?
That's it.
Oh, sorry. Okay,
This is just a recommendation, so for my media friends, nothing's being decided today. It's just the first of the conversation. And so with that, we have about 2 minutes for questions. Councilmember Brazington, you had your hand up?
Yeah, thanks, Bill. Do you have available to share verbally now the percentage of hourly users who stay less than 2 hours?
less than 2 hours, we do. During an annual basis, it is around 500,000 people who stay 2 hours or less. I do the first hour free, the second hour is 258,000. I didn't do the 0 transactions that we have, which is the first hour free, but it's about the same, which is maybe 250 to 300,000 people come in and leave it in the first hour.
And as a percent,
As a percent,
you can follow up. I know it's on the
yeah,
file.
I'll have to follow up with that.
Okay, maybe that's something, just a data point.
Absolutely. We'll follow up with y'all on that. Yes, Councilmember Dow.
You know, I don't, we've looked at this. And I don't per se have a problem with, given how long it's been since there's been an increase and given the investment the city's made and seeing parking garages in some of our peer cities' conditions compared to how good ours are, where I want us to be diligent if this is supported, that revenues earned by the parking garages need to be spent to keep our parking garages up to snuff. I mean, ours are very good looking. Many are aging, and it's just critical that we invest in them with these revenues to keep them up and running in the standard that all of us would expect, because we've seen where that's not happening in other cities, and it's really deplorable. So sometimes we use parking money for new parking garages, for example, which of course, but to me, that revenue has to be reinvested in parking.
Noted. Thank you. Mayor?
Yeah, and I was just
Final
noting,
comments.
yeah, some of the parking garages in our sister cities are in deplorable condition, and some of our other sister cities have depended on parking revenues for general fund purposes and have gotten themselves in big trouble because now they've turned around and their garages are in dire need. So we have not been down that road. Ours are really in good condition. One thing that always has made us different though in this whole parking issue is we've also kept an eye on what the real purpose of the parking fund is. But at the end of the day, it's about our businesses downtown. It's about the retailers, the shops and the stores. And so when we've had consultants in the past that have urged us to put in parking meters, and we have, at least on 2 occasions I can think of, we said no, even though, so we still have free parking on the street. That's 2 hours. And people, that's so different from most cities. We've also had free parking on weekends, Richard Street Garage, GTA parking deck, all that's duly noted. Poinsett Garage during the time of the farmers market.
Mhm.
I still believe it would be a good thing to keep in mind the merchants. And what we hear from the retailers is there is a certain anxiety about the 1 hour parking in the garages. It's 1 hour is hard, even though it's not that much to stay an extra hour and a half. That comes out of all our meetings with retailers of the years and restaurants. People have this in the back of their mind. They have to get back in time for the parking. And 1 hour is not enough really to do what you want to do. So I still would rather us at least take a good look at, try to continue to move toward free parking in the garage. It's just like the street, 2 hours of free. I think, hours beyond that, yes, we could have a bigger increase if you're in the 3rd, 4th, 5th, 6 hours of daily parking. I think the higher amount there would be a better place to put the higher amount. Because when people going to the Mass General Store or going to a restaurant, 2 hours is really what they're interested in. And I think that's kind of the end of the day, that's why we do this. That's why we have garages in the first place. So I'd still rather us take a look at that, run those numbers and see what we can do.
Okay. We will go back and look at that. Any final comments for Bill? All right. Thank you, Bill. Thank you very much. Bill, yeah, thank you, Bill. Woo!
Time you go to the city, think about Bill. Thank you, Bill.
Yes, we should be very grateful for Bill and the entire parking team. We have a great parking team, so thank you very much, Bill.
Now, wait till you hear this next one.
I know. Now we're moving from parking
That is a great picture.
to stormwater and floodplain management. So
We've seen that.
we recently had some information that was out there about, where was the condition of Greenville stormwater? And, I know that we have made a lot of investments over the years in our stormwater program. And, we have been led by Paul Dow on this area for many years. So we thought it was a great opportunity and time for us to present council an update on our stormwater and flood management program. So with that, I'm going to turn it over to Paul Dow, our city engineer.
Thank you, and I'll go quick. I'll keep us on schedule here. So on the heels of Hurricane Helene, and of course, lots of catastrophic news that we've seen lately on stormwater and flooding, we wanted to make sure we took a minute here to talk about our stormwater and floodplain management program. As Shannon mentioned, one of the lessons learned in Helene was misinformation. And it's incorporated in our multi-hazard mitigation plan about how to battle misinformation. And so we've had a little bit of that recently, and it's unfortunate that the fears and concerns that people have are being preyed on. So please let me know if you have any questions when I go through all the elements of our stormwater program here. But,
What kind of misinformation?
oh, so the city has no plans. The city has no projects. The city's development increases flooding risks and things of that nature. So,
Okay.
that's kind of my scope here today, is to talk about what we actually do. And I have some of our experts here in the room as well that I'll shout out to in a little bit here. But just to give you an idea of where we are in the calendar, right? We're in August, and this is a chart of national billion-dollar catastrophes, right? And so you can see that we're in that time of year when they happen. So your tropical storms are by far your most expensive disasters, for sure. And then you can also see that we're seeing recently more billion-dollar events than ever. We got the top 4 two-day precipitation events at GSP. We just went through Helene for number 4. Contrary to what we may have heard in some other presentations, expect it to happen again, right? Do not expect it to happen 50 years from now or 100 years from now. We have to be prepared. We have to expect it to happen and plan appropriately. Am I doing this? All right, so I also wanted to touch on the difference between nuisance flooding and our 100-year flooding events. So think about Hurricane Helene as a FEMA floodplain event where everything was inundated. So that middle photograph there is the fire station. And that's when, flooding reached well into the actual usable space of a building. And to the left is what I would call nuisance flooding. That is not a named storm, but that is someone's house, right? So if you're that person, you're taking that very seriously, right? That's just a storm that doesn't necessarily make the news, right? But I also say about nuisance flooding, we have lots of neighborhoods and lots of houses that are built over stormwater conveyance, over old creeks. So you can imagine 50, 60 years ago, somebody built a house and they put a pipe in there to have the baseline of a creek flow. And then every single time it rains, we're now talking to the 3rd and 4th homeowner. We're talking about a lot of nuisance flooding. So a lot of our program deals with both the large events and those smaller nuisance events as well. So what is our overall strategy? Our overall strategy is appropriate development regulations and appropriate uses within the floodplain, right? So we're not advocating to fill in the floodplain and build massive walls. We're having things like Unity Park that is the appropriate use within the floodplain, something that can get inundated and recover and be a public space, as opposed to promoting more risk within the floodplain itself. So I'll jump to stormwater operations and our public works crews that work diligently every day on our stormwater system. And I always have an opportunity to explain our, extent of service policy, where, the city works within the public right-of-ways and in city property. We don't necessarily have the right to go in someone's backyard and dig up and change drainage patterns in someone's backyard. Now, every single day, when folks have issues, they call our office, they call Derek's folks, and we go out and we will consult with folks all the time. We do that every single day. So there isn't a single spot on this city that we won't look at and help with, for sure. Keep on going. I want to try to make up some time here. So yeah, so public information is a huge thing. So we have really good public avenues to find out your flood hazard, knowing your flood hazard. You can put in your address, or you can actually send in a request to the engineering department to find out exactly the elevation of flooding that you have. We have 7 certified floodplain managers on staff. Brooks Dixon here, future mayor, you heard it here first. Lucas Price, he heads up our stormwater engineering program. We've got Robert Rue as well. I will put my team against any engineering office in this entire city.
I second that.
Yes, as far as capabilities, professionalism in this matter, for sure. So development standards have 3 major components: water quantity control, water quality, and then floodplain management. So water quantity is to try to mitigate the effects of development from a pre and a post construction situation. Water quality also has that quantity element as well, but of course it's about removing those pollutants of concern from the waterways. Floodplain regulations, there is a community rating system that's national. So FEMA audits our entire floodplain management program. Very detailed, very long audit of everything that we do. We are, there is only 2 communities in the entire state that are ranked better than the city of Greenville. So that translates to a 25% discount on anybody that's getting flood insurance in the city. So
Say
here's,
that again, Paul, so that doesn't get missed.
Yeah.
How does that work for the
So-
taxpayer?
so you don't need to be in a flood zone to get flood insurance, and flood insurance doesn't always cover, or homeowners policies don't cover flood damages. And so looking at a flood insurance policy is a really smart way of protecting your home. So if you're outside of a FEMA floodplain, you're going to get a lower discounted rate than somebody that is. But every single person in the city, because of our floodplain management programs and the things that my team does here, everybody benefits from a 25% discount in that rate. And so here's a list of here's a snapshot of active stormwater CIP projects. So some of these are wrapping up, some of these are finishing, and some of these are starting now with preliminary design. But we're excited to get a few of these going. And then my last slide, we did want to talk about a couple of underfunded projects. And they are underfunded mainly because of ownership, right? So Stone Lake Dam, the reinforcement of that overflow for the dam, the homeowner association technically owns the dam itself. And so it's not necessarily a 100% on the city to have that sort of thing. Similar with the Lawrence Road flooding, there's a county portion and a DOT portion for that system that the city doesn't own 100% of it. Yeah, so I rushed through it. Sorry, I was rushing, but that is my presentation. I'm ready for questions.
Okay, we have about 3 minutes for questions. Councilmember Gibson, followed by Councilmember Dow.
Just real quick,
First.
on that Lawrence Road flooding project, do we expect that the shortfall is going to be made up, and how do we expect that to happen?
That is coordination efforts with this state, county, and the city that I am not aware of where we are right now.
Okay.
Did you say it on Stone Lake Dam?
I'm
No,
talking
he's talking
about
about-
Lawrence Road.
Okay.
Yeah. I think the Stone Lake is private, right? Maybe the HOA.
HOA on Stone.
Have they indicated in any way whatsoever whether or not they're gonna come up with that?
So
State fund,
especially
they're
Stone,
gonna have to
especially,
state fund.
exactly, especially Stone Lake Dam, we could have to help them pursuing grant.
State funds? Okay, good deal.
Thank you. Councilmember Dow.
So we have $1 million in CIP towards stormwater. So does that plus fund balance cover, is it enough to cover what was on the previous capital project slide?
So no, but those capital projects are in various stages. So,
Right.
so
So
some
some
of
are
them are completely
design.
funded and ready to bid. Some of them are in design and we only have a fraction of what's overall needed for the, and a lot of times these projects are 2 to 3 years in the making, that there's a design and there's a funding buildup for sure.
So, but as long as I can remember, it's $1 million a year towards
Been
stormwater.
that way for the last few years, yes.
I mean, how long has it been?
Before you, right? I mean, it's
That's what-
been that way for
Yeah.
a good 6 or 7 years.
I've been here longer than you and it's been $1 million after 5
I
years.
know.
I mention it because we have a number of CIP line items that have been the same amount over and over and over again. In step was one, although I know we got into a nib thing on it. But stormwater to me is a little bit different as a capital item because the need for it is affected by development. So as we grow, our stormwater management needs grow. And
And I would say to that point, from the CIP perspective, which is, I don't think it's unique to city, but it's just it's a way of saving year over year. So you might see the same amount, but what happens, because you don't see the total project balance, is that there's actually a balance of like $3+ million. I'm going off memory, so I don't.
1.6.
Okay, one, in the actual stormwater.
Well, this is an extreme rough. I don't want to detour too much. I know it's making you nervous, but I'm just saying that
It's like, you'll see the same amount, so it's almost like a way of saving for certain projects, so that the funds are there. Now Paul and I talked, importantly, shortly after the budget was passed, about making sure, based on your comments, actually, Wendy, making sure that stormwater was addressed up front because, well, we can talk offline about it.
here's my overarching 70,000 foot point. That there are things in the CIP that are the same amount year after year after year after year. And they are not allocated to cover the annual, but they're not based on it, they're building a fund, right?
Correct.
Certain things grow in cost because of construction costs and material costs. Like sidewalks are a lot more expensive than they used to be, right? But stormwater management grows because of that, as well as the need to address it is growing because our city is growing. So I'm just saying the same amount year after year after year. In looking at that one I look at a little bit differently. So I would just say that maybe as we head towards next budget talks, just a thought on that.
Something that we can talk about in retreat.
Sure,
as we go
in
into
retreat. And
Honestly,
also,
I mean, I would just say that Paul and I have talked about it and have a plan to address it earlier in the budget cycle.
Okay.
For the upcoming year.
the other thing is the amount that comes in from property taxes on the stormwater set aside that's a set, you're either one level or the other, and that's not growing, right? It's set by us and it hasn't grown in a long time, and we're gonna keep it at that. I don't know when the last time it was raised. Maybe 2015-ish, 2017.
So there was an inflationary increase
Inflation.
last year, yeah.
I know we did this year now, we did pass. One
It's been
thing,
a while, I think.
two kind of fundamental things. Years ago, we took care of all the big basins in the city. That was the big thing.
That's right.
Parkins Mill used to be, 25 houses in Parkins Mill used to flood on a regular routine basis, all fixed. White Oak, regular number of houses, all fixed. Around McAllister Square, we ended up buying houses. We bought like 6 houses just to get them out because we couldn't fix it. So we did some like major lifting, if you will, on stormwater in areas that used to flood because that's just the way it was. They always flooded, but now they don't. So it's a nice thing. Yeah. The other thing is that our standards are higher. So when we have new development now, we do all the right things. It's hard to imagine this, but you mentioned McAllister Square. They built McAllister Square back in the 60s, I guess, early 70s. And they had a big parking lot. They just dumped it right in the neighborhood. There was no such thing as a stormwater management plan for McAllister Square back in those days. But now we have requirements and all in place. So that's helped a lot just overall in the city.
Thank you.
Councilmember Bradenton, and then we'll finish with Councilmember Fleming. Okay.
Is this 4.6 just us or the shared county and state?
That would be what that project costs, so ideally it's a shared cost.
Okay, so for all willing people to participate, is there a regular cadence whereby those 3 entities check back in on the opportunity to address this?
Hoping this meeting kicks it off again. We've had several, but there hasn't been one recent.
Yeah, well, let's hope it does kick it off. I know it's a big number, but it's a big deal. And I can't recall it coming before council in years. So thank you for putting it before council.
Thank you.
Thank you. Thank you for allowing us this opportunity. I think it's really important that when there's questions about things like stormwater, especially as we're back in hurricane season, that we're providing the facts and the information about the city's program. So
Yeah, I only wanted to ask that those that are fully funded, can you send that to us?
Yes.
Okay, thank you.
we sure can. Thank you, Councilmember Fleming. We don't take questions from the audience during work sessions. I'm sorry. But we will get with Paul.
You can.
Yes, Paul will talk with you during, after. Thanks. Okay, very much. All right, last item on the agenda this afternoon in our regular session is please welcome Monique Madison, who is our Community Development Manager for the city. And she's got her team here as well. And I think she's got some community members with her today also to talk about a new initiative that that her team has been working on that would like to launch later this month, and had a good backpack event that they worked on together right before school started. So Monique, welcome. We haven't seen you in a minute, but we're glad to have you back.
Thanks. Well, I am really nervous. I'm not like Amber. I'm actually nervous.
Don't be nervous. You got a lot of friends in the room. Don't be nervous.
I do. Thank you guys so much. So we are here as a community development team to introduce you to our current multi-level approach to Kaizen community development through our iCare Community Hub. And so, you can go next slide. Before I start, I want to just really say thank you to the Community Collaborations Network. So it's our network of nonprofits. They are faith-based leadership, and they are small for-profits as well as banks and credit unions. Many of them are in the room along with our neighborhood leadership.
Can you raise your hand if you're part of our group so that everybody knows? Great. Thank y'all very much.
So they are here. We've been working since February on this initiative. And so we're here to really introduce this to you. We're very excited and moving really fast. So as you know, this community development continuum supports our low to moderate income residents through HUD grant funding. We support our special emphasis neighborhoods through community empowerment team. That's neighborhood association meetings with our new Greenville Neighborhood Leadership Initiative, which trains our young and up and coming leaders of our neighborhoods to become involved and empowered in the city of Greenville. We support our micro enterprise and small businesses through our up and coming also micro enterprise development team, mentorship program, and our resource fairs. You will have that information shortly. That's up and coming. And lastly, what we want to focus on today is our nonprofit and faith-based leadership and for-profit partners within that community collaborations network. This network has been working really hard since February to come up with this concept and initiative of the iCare Community Hub. We will use Kaizen community development, which is small incremental steps to comprehensive services and quality of life improvements to address healthcare, social services, education, legal representation, housing, and city services. So the iCare Community Hub will be a centralized cross-sector collaboration where residents can access multiple services under one roof, from housing assistance and job readiness to healthcare and legal support. So the entire idea is grounded in Community Development's 2025-2029 consolidated plan. Within this plan, we will support 3 of our 6 goals for the next 5 years. So we are to support public services for low to moderate income and special needs residents, affordable housing, and economic development opportunities. The consolidated plan that was just completed in June and has been submitted to HUD recognizes that Greenville is experiencing a rising demand for public services due to economic hardship, housing insecurity, and limited access to healthcare and behavioral health support. The gaps that were identified are shelter, mental health, and substance recovery services, limited job readiness programming and senior outreach, transportation barriers, and lack of centralized delivery sites, and missed opportunities for collaboration among providers. Despite many dedicated organizations, service delivery can be fragmented, making it difficult for residents to navigate multiple systems and access timely help. So Our mission and vision from the Community Collaborations Network, the next phase of innovation. We offer a cross-sector collaboration of nonprofits, faith-based institutions, and community-based organizations, intentional engagement through strategic partnerships, shared resource allocation, and comprehensive gap analysis. Human Services Solutions Center will have coordinated responses that reduce duplication and enhance service delivery. One Roof, many resources. We are proposing a pilot program with this overview. Where? The Sears Shelter at McPherson Park. We are prepared to launch in September and host this hub every other week through November 2025. What? Comprehensive on-site support. Throughout the process, we've had 20+ nonprofit and governmental partners, as well as for-profits and banking institutions, to meet and collaborate and talk about what they needed to, best provide services for the city residents. We will provide in-person access to essential services, a printed and digital resource guide. Monthly coordination meetings for service providers will continue as a base ground level training program for any of these groups that chooses to join the hub. How? Community development is prepared to host a centralized client intake system called Unitas that is utilized by many of our larger nonprofit partners. So we will host that. We will provide that at no cost to our smaller nonprofits, and we will train them to use that service to intake clients that walk into the hub. Why? The pilot aims to remove barriers, reduce duplication, and help individuals and families access services more easily and efficiently. The pilot is prepared to launch September 2025 with this governance structure. We have a steering committee, and we will have hub navigators, each provided by community development staff as well as our nonprofit volunteers. We will have partner liaisons that is already in place in the collaborations network, and we will pull together a community advisory board. We have that somewhat in place with our empowerment team so that residents and community members are always informed about what's going on and what they need from us in this process. And that's it.
Thank you, Monique. This is very exciting, and we wanted to make sure that council had first look and first knowledge of it before it launches in September. They had a great pre-event with the backpack event that was held, I think, right, like July 31st.
31st.
That's right. And we also, separate from this, have one of our community resources fairs coming up. September 6th, which those have been very successful. And so I would encourage anyone, if you haven't been, to go out to that. That's a Saturday. And it'll be at, I'm assuming at Unity Park again, like our last one was.
Yes.
Yes. But this is a very exciting initiative, and we're really happy to have all of our partners here in the room today, because there are a lot of partners that are working with Monique on this. They are a community development team, and we could not do this without y'all. So thank y'all very much. Does anyone have any questions or comments for Monique before we launch in September?
In September.
All right. Okay. Councilmember Gibson.
I think this is outstanding. And this is something that quite frankly, we're seeing across our community, in that we have a number of service providers that do various things, but they do not collaborate and they do not get with each other. True story. First time you guys did the community service fair, I went around and I talked to all the groups. And now I got near the end and I talked to one group. I can't remember exactly what they did, but it's like, oh, our mission is this, blah, blah, blah. I said, okay, that's awesome, outstanding, great work. Went right next to the group right next to them. They did the exact same thing and did not know each other. Had no idea that either one of them existed. So the fact that you guys, are going to sort of try to get together and sort of have the groups collaborate and sort of work better together and fill those gaps is great. And I also love the idea that you guys you're basically taking the community initiative where you do at Unity Park, but instead of just notifying people about what services are out there, you're actually going to be providing services. So I think that's just outstanding. I'm very excited about this.
Thank you very much. All right, great job, Nerdy.
And also, one thing, so in case anybody's wondering, okay, we're gonna launch in September and through November 2025. At that point, we're gonna see what the impact has been and whether or not, what changes might be needed to the overall program. What additional partners we might be able to bring in. These are the smaller partners, to your point, because I think unless you're in that big space, like a United Way, a lot of these other partnerships are overlooked or don't know how to connect. So just want to make sure that that is clear. It is a pilot at this point. We will gather the data and be able to make a decision about effectiveness later this year.
Thank you.
A great thank you to everybody in the community development team as well as Donna. Who is actually with Parks and Rec and Tourism, who has just stepped up and really helped throughout the entire initiative.
Yeah, thank you, Patricia. She has been just instrumental and amazing, and I wish I could just pull her over to the community.
All right, Mr. Mayor, that concludes everything on our regular work session agenda today, and now we are ready to move into executive session.
Okay, all in favor of executive session? Motion.
So moved.
Second.
Thank you. Thank you.